Hello everyone, this is Dr. Seaton with the Chiropractic Place here in Redding, California. In today's video, we're going to be talking about pinched nerves. And these can happen not just in the neck, but they can also happen down in the low back. And they have this distinctive pattern that exists when they start. Typically, we can feel like a burning or a numbness kind of coming on. People describe that. The pain most of the time, not all the time, but most of the time tends to worsen at night. This can happen in the lower neck and start sending these signals kind of into your upper trap and down into your arm. That's that distinct feeling people get when they describe it as a pinched nerve coming in out of their neck down into the arm. We also can get pinched nerves in our low back. Getting low back pain kind of comes down into the pelvis, into the buttock, maybe down the leg. So that's the classic presentation of a pinched nerve. And so there's things that you can do to help better understand what's going on in your specific case. First off, we need to understand the underlying issue that's going on. And most of the time, that underlying issue exists in the spine because those nerves, when you feel that pinched nerve coming down the arm, well, they originate right up here in your neck. Or if your leg and you're feeling a pinched nerve down your leg, those originate in your low back and in your pelvis. So what we do in our office is evaluate that underlying issue in the spine. We do digital x-rays in our office so that we can take a look at these areas of the spine, see is there any existing arthritis, degenerative disc disease, is there a change in the curvature? Maybe it's something as simple as that there's been some postural issues that have been going on for a while. Was there a recent trauma of any kind? Did they fall asleep in a weird position causing their neck or their low back to lock up? So there's a lot of different variables as a chiropractor that I'm looking at when somebody describes that they have a pinched nerve. I want to hear kind of what's happened. Has it been the last few days, the last few months? What are some of those underlying factors so that we can kind of get to the root of the problem? Obviously, we want to take those x-rays as well so that we can see that area of the spine. Is there anything in there, anything that we could indicate what's happened or better help us serve that person to get that pinched nerve to clear up? So what to do about that? Most of the time that we see somebody with a pinched nerve, it's some bone is stuck and we need to put motion back into that joint to get pressure off of that nerve, right? So we have bones in our spine, and between those bones, what exits out are those nerves. And if that bone gets stuck and is putting pressure on that nerve, it makes it really hard for that nerve to properly function. And that's what can trigger that pinched nerve feeling. So if you've never been to a chiropractor, and if you've ever are experiencing this pinched nerve, rest assured what we do in our office is we do detailed history and consultation with the patient. We're going to take digital x-rays to better understand how to help you, and then we're going to get down to getting you adjusted and getting that moving if we find what we're looking for. So if you have any questions about pinched nerves and you have any questions about chiropractic care regarding pinched nerves, please give our office a call. We're happy to answer any questions that you may have. My name is Dr. Seaton with the Chiropractic Place here in Redding, California.